The most news in the morning. CNN's American Morning. Weekday, 6 a.m. Eastern.
A new study may explain why more black patients die from heart disease, and it all has to do with, of all things, vitamin D. We're paging our Dr. Sanjay Gupta, CNN's chief medical correspondent, is in Atlanta this morning. Sanjay, what's this all about?
You know, I found this really fascinating, John. You know, for a long time, people have been trying to figure out why do these disparities exist between heart disease and between blacks and whites. And one of the things they focused on for some time is this idea that sunlight exposure, simple sunlight exposure, may be one of the reasons. So they started to study this more and more, and they realized that blacks, especially blacks who live farther away from the equator, and they specifically are getting less sunlight exposure, seem to have higher rates of heart disease. And in fact, it can be up to 20 times higher. So it might just have to do with vitamin D production in the skin. It might simply have to do with how much sunlight they're absorbing across the skin as well. You know, vitamin D is an amazingly controversial vitamin. Now, they say that you need 400 international units per day. That's according to federal guidelines. But there's also talk that, you know, a lot of researchers who study vitamin D are taking up to 2,000 international units themselves. You can take up to 10,000 without it really having much harm in the body. So people really aren't sure about how much vitamin D to take. But it does seem to be clear that blacks, because they're absorbing less sunshine, probably need to take a little bit more.
So what's the relationship here? You know, vitamin D typically associated with calcium delivery, depositing on bones, strengthening your bones.
Right.
What does it have to do with heart disease?
Right. It's a great question. And, you know, first of all, not everyone has sort of bought into this idea that more vitamin D lower heart disease, although it does seem to be gaining some momentum. The thought is that, you know, if you look at heart disease, one of the buzzwords here is inflammation. More inflammation in the bloodstream, the more likely you are to have heart events, or coronary events as they're called. Vitamin D seems to suppress the amount of inflammation in the body. And that's mainly in animal studies, John. That hasn't been really proven out in humans. And it's also unclear that, you know, more vitamin D leads to linearly less inflammation. That's still, you know, a very fertile area of research.
Okay, but we do have this problem that a lot of people are not getting enough vitamin D. We've heard these stories about, you know, parents who put sunscreen rightly on their children cuts down on vitamin D absorption. So how can people, whether they don't get enough sunshine because they don't go outside enough, or maybe they're wearing sunscreen when they do go outside, how can they be assured of getting enough vitamin D every day?
Well, you know, first things first, you know, I think that there is a way to test for this. So if you're concerned about this, you can get a derivative of vitamin D checked in your blood, and it's called 25-hydroxy vitamin D. You don't need to remember the name, but remember the number. It should be 30 nanograms per milliliter. You want the number to be higher than that. If it's lower than that, keep in mind that a lot of foods are fortified with vitamin D, cereals, for example, for kids, but a lot of dairy products, as everyone knows, milk, cheese, foods like that. Getting outside and getting real sun for about 20 minutes a day will give you 20,000 international units, far more than you need. So just getting a little bit, even for the kids, probably not a bad idea.